Thank you for joining me. We're nearing the 2-month mark in our fight against the 2019 novel coronavirus. And so far, the public health aspect has been our #1 priority because there is nothing more valuable than life. Now we're reaching a point where we can more fully address some of the economic effects of COVID-19. An estimated 1 in 6 Pennsylvanians who are currently able to work do not have a job. Some of these Pennsylvanians have been laid off due to a temporary closure and will soon resume working, but many others worked in a job that has permanently disappeared. As businesses begin to reopen, we're walking a tightrope between health and economy. Though the spread of COVID-19 has slowed, we have not eradicated this illness, nor have we cured it. We anticipate many months to pass before we have a vaccine, and some current projections show a resurgence of the virus in the fall. We do not want to spend the next few months or next year cloistered inside our homes. We want to be able to resume working, going to school, going to church, and visiting our loved ones. We want to reopen businesses of all types, and we want to be able to do this with as little risk as possible. When this virus first arrived, we had very little time and knowledge to prepare. Now we have the gift of experience. We have better testing capabilities. We have a more robust contact tracing system in place, and we have a better understanding of the virus's transmission. To reopen our economy to its maximum potential, we will need to boost our ability to contain this highly transmissible virus. So I am proposing the Commonwealth Civilian Coronavirus Corps, a new program that will expand our ability to conduct contact tracing and testing and mobilize Pennsylvanians to do all sorts of things to contain the COVID-19 virus. The Commonwealth Civilian Coronavirus Corps will reduce our unemployment rate while making a lasting health and economic contribution to our Commonwealth. By maximizing our testing and contact tracing capabilities, we can contain COVID-19 without widely freezing the movement of Pennsylvanians. If Pennsylvania protects its ability to produce and sell goods and services, our economy will regain lost momentum. The Commonwealth Civilian Coronavirus Corps will not be a replacement for everyday hygiene, wearing masks, social distancing, nor will it replace our health care and other workers who already play a vital role in contact tracing. We will likely still be unable to resume activities with large crowds such as concerts for fear of infecting an enormous number of Pennsylvanians at one time. But effective containment will allow us to resume life as much as possible. We have slowed this virus through shared sacrifices, and we have bought precious time. We need to now use that time effectively by building a program that will allow our Commonwealth to function as much as possible while we wait for a vaccine. And we need to regrow our economy. The Commonwealth Civilian Coronavirus Corps is my plan to do this, and I will continue to unveil aspects of this plan in the coming weeks. In the meantime, thank you for your patience and thank you for your continued support as Pennsylvania continues to work together to get through this crisis. Now, before I turn this over to Secretary Levine, I'd like to extend a special thank you to community health nurses in honor of World Nurses Day. As we reopen our Commonwealth, we will increasingly rely on community health nurses who form the backbone of our contact tracing program. Community health nurses have always been essential to the health and well-being of Pennsylvanians, and now they're even more important, and they deserve the gratitude from all of us.